The small intestine, you can see that there's irregularity and rounding. Now, yesterday, somebody asked me, what do the gas bubbles look like? Do you see that little crescent right there? Do you see how it's crescent shaped? The gas bubble, it's not round. Because as the bowel plicates, the gas bubbles become crescent shaped. Now, if you weren't comfortable with the diagnosis of obstruction and linear foreign body, what could you do? You could do a variant series, you could do ultrasound, but something that's fast and easy, we talked about the first aid is compression. We use a radiolucent spatula or spoon and we compress the abdomen. What we're trying to do is isolate a loop of intestine. And if you look at this intestine, you can see that it's plicated. It's going back and forth and back and forth. Look at this loop of bowel, how smooth the margin is. And then you look at this loop of bowel, see how smooth that is? Look how one margin smooth, the other one. But look at how irregular the bowel is here because it's plicated. This is what it looked like at surgery. And it's this plication that gives this irregular appearance. But if I'm not sure, I can use this compression to isolate a single loop of bowel to see it better. The problem with radiographs, if you've got so much superimposition from right to left or from ventral to dorsal, with compression, I can reduce that superimposition or that overlap. So, take home. What does a linear foreign body look like? Look for the crescent or the abnormally shaped gas bubbles. Gas in the small intestine should normally be round or tubular. When you start to see angles where it's changing direction and its shape, that's when you start to think about plication. All right, great job. This second case is also due to a question someone asked me. 1-year-old lab vomiting. So what are the radiographic changes that we see? What are the recommendations that you want to make? Now, you may not need recommendations. A recommendation may be to treat them for the vomiting medically or send them to surgery. But you may have recommendations from an imaging standpoint, and that's what I want you to think about. So number one, and is this normal or abnormal? How many people think this abdomen is abnormal? Outstanding. Now, what bothers you most? And think about it. He's vomiting. It's an older dog. He's vomiting. Big stomach. Oh my God, that's good. Who said that? The stomach is big, but I'm gonna put you on the spot. Is the stomach distended with gas, fluid, or both?
Gas y líquido.
It's really mostly gas, because look how black it is. It's actually more black than it is gray. Now there's probably fluid in there, so I'll take both. But it's not that dramatically gray. So I'm thinking it's more gas, so good pickup. How about the small intestine? Normal, abnormal? Abnormal. There's especially a loop of bowel right here that's greater than, for those of you who were yesterday, remember, we look at L5 and we look from ventral canal, spinal canal, to ventral vertebral body. The bowel should be less than 2 times that width. This is greater than that. What were the other key words? Segmentally distended. It's segmentally distended. It should be non-uniform small bowel, right? Multiple populations based on size or width. Even though you've got gas in these loops of small intestine, they're normal. They're normal. They're not abnormally dilated. So this meets the criteria of an obstruction. Now, can you tell me what the obstruction is? You can't tell me? Look at the loop of bowel. Do you notice it abruptly stops right there? Does everybody see how that loop of bowel, I think, continues on normally? But look at how it abruptly stops. The other thing is, if you look, and I apologize that this is so pixelated, but where is the small intestine here? It's actually what we call a mass effect. All the bowel's been displaced around it. But more importantly, is look at that edge. Look at the edge right there. We call that a meniscus sign. Does everybody see the curved edge right here? That meniscus sign is characteristic of the cause of the obstruction in this dog. Does anybody know what the meniscus sign tends to lead us to think about? What? Tumor. A tumor could do that. Anything that's in the intestine, right, that's causing an obstruction and the gas meets it, creates that appearance. But classically, so just the meniscus sign comes from gas surrounding a rounded edge. So it could be a tumor. It could be a foreign body, like a ball. More commonly, it's an intussusception. The most common cause of a meniscal sign. But what's important here, it's not the cause, it's that you recognized we had multiple populations of small intestine. One of that population is pathologic, depending on comparing it to L5, the fifth lumbar vertebra, right? And it's easy to see why. Gas filled. Good. And we ultrasounded this, and the fact is, it was an intussusception. Here's a loop of bowel, surrounded by a loop of bowel, and this is mesentery. This is mesentery. So you were right, it was an obstruction. What do? We go to surgery.
Es una obstrucción.
Now, for those of you who were at my talk talking about there are more to the thorax than the lungs and heart, this is for you. So this is a 6-year-old male castrated lab that's dyspneic, lethargic, and not eating. Normal, abnormal. Abnormal, abnormal. It's an easy abnormal, right? And when we look at it, we see what in the thorax that we can tell is making this animal dyspneic. Pleural effusion. This animal's got pleural effusion. We can see this really nice example of the lung is being displaced away from the chest wall. We can see fluid between lung lobes. We see pleural fissures, right? So we know this animal has pleural effusion. Now, somebody made a very important point. When we don't see the diaphragm, there are 3 things we should always think about. Diaphragmatic hernia, pleural effusion, or disease in the lung lobes against the diaphragm. Those are 3 things.
Esas son las 3 cosas.
We can have a
Podemos tener la
diaphragmatic
combinación,
hernia
podemos tener una
with
hernia
pleural
diafragmática
effusion,
con un derrame
right?
pleural, ¿verdad?
Or we can have
podemos tener
a lung lobe
Una
disease
enfermedad
and
del
we can
lóbulo
have pleural
pulmonar y
effusion.
tener derrame pleural.
So,
Entonces,
is there any, so you're right, we have pleural
aquí hay
effusion,
derrame pleural,
we have
effusión
border
pleural, tenemos
effacement,
aquí
we can't completely see the heart,
borramiento, no
and we
podemos ver el
don't completely
corazón
see the
y no vemos
diaphragm.
tampoco el diafragma.
But remember
Pero
when we
acuérdense que
talked
cuando
about
hablamos de
looking at the thorax,
ver
we
el
talked about
tórax,
how to be systematic.
y tenemos que ser
Look at the
sistemáticos. Tenemos
extrathoracic
que ver
things. Look at
los
the
elementos
neck or the front
extratorácicos
legs. Look at the
como
cranial
las
abdomen.
patas, el
Look
cuello,
at the
el cráneo, el abdomen.
spine.
Hay que ver la
Look
columna,
at the
hay que
sternum.
ver el
Look at
esternón,
the chest
hay que ver la pared torácica.
Does anything about this
¿Hay
case
algo en
bother
este caso
you other than
que
the
les haga
inability
ruido?
to see the heart,
Además de que no pueden ver
inability
el
to see the
corazón,
complete
además
diaphragm,
de que no
pleural
pueden ver
effusion?
todo el abdomen,
Look at the
derrame pleural.
shape
Vean ustedes la
of the
forma
areas that
de
you
las
think have
áreas
pleural
en
effusion.
donde está el área, el derrame
Look at
pleural.
this
Vean ustedes
side
este lado
versus
y
this
compárenlo
side.
contra este otro costado.
So you think it's got a
Entonces,
mass?
piensan ustedes que
Look
hay
at
una
that.
masa.
Look at
Vean,
how it's
observen
rounded,
cómo está redondeado
right?
aquí.
It's rounded
Está
right there.
redondeado ahí.
Also, look at the
Y también
difference
vean
between the
ustedes la
right
diferencia
lateral
entre el lateral
and the left
derecho
lateral.
y el lateral
Look at
izquierdo.
the
Vean
effusion
ustedes
here.
el
Look
derrame
at the
aquí.
effusion
Vean
here.
ustedes
See
ese
how it's
derrame
got
pleural
a
acá.
more
Vean cómo tiene
well-defined
aquí
border?
un borde mucho
Okay.
mejor definido.
Why don't we do this?
¿Y por qué no hacemos lo siguiente?
What if I told
¿Qué
you this
pasa si
animal had
les
a
dijera
hemothorax? We
que el
tapped it and it
animal
was
tiene
blood.
hemitórax y que
Right. Here's the
lo
right
probamos y
lateral.
tiene sangre? Aquí tenemos el
Here's that
lateral,
area that we
aquí tenemos
saw.
el área que nosotros
Anything
vimos
else about
y
this
el
area
resto de esta
bother
área
you?
les molesta,
Remember
les
I
hace
said,
ruido.
look at the
Acuérdense que
chest
les dije que
wall.
tienen que ver la pared
Look at
torácica,
the ribs.
tienen que ver las costillas,
Look at the
tienen que
ribs.
ver las costillas.
What's missing
¿Qué es lo que
right
falta
here?
aquí? ¿Qué es lo que falta aquí
Look
en
at
esta
that
zona?
rib.
Vean ustedes esta
Look at that
costilla,
costochondral
vean
junction.
esta unión
Where the heck is the rib?
costal-condral, ¿dónde está
And you
lo
see
que
the
falta
little
de
bit
esta
of
costilla?
mineral?
Y ven un
You see a
poquito
little bit
aquí
of mineral in the mass?
de área mineral o de porción mineral en esta masa.
Cayó
Look at the
óseo.
Vean
mineral.
ustedes
Here's
ahí
the
la
mineral.
parte mineral, aquí
Where's the
tenemos
rib?
mineral y dónde está
The
la
rib is
costilla,
gone.
y la costilla
Now let's look at the
desapareció.
VD.
Vamos a ver ahora la vista ventrodentral dorsal.
Look at
¿En
that
dónde
rib.
está esa costilla?
Look at that
Vean
rib.
ustedes ahí esa
Look at how
costilla
that
y
rib
vean cómo la
stops
costilla
abruptly.
ya de
Look at
repente
the
se
little
detiene
bit of
abruptamente.
mineral.
Vean un
And by the
poquito
way,
de mineral
look
y a
at the
propósito
change in
vean
the soft
ustedes el
tissue.
cambio en los
See
tejidos
that
blandos.
fascial plane?
Vean ustedes el plano facial.
Look how it's
Vean
bulging
cómo está,
right there.
hay una
See the
protuberancia.
soft tissue
Vean ustedes
here?
el tejido blando aquí.
And the other thing I talked
Algo
about the
más
other
que el
day
otro día les
is when
comenté
we have
es que
an
cuando tenemos aquí
extrapleural
una
lesion. In other
lesión
words,
extrapleural,
usually
es
that's
decir,
of the chest
normalmente
wall or the
está en el
diaphragm.
diafragma, en la
Instead
pared
of being an
torácica,
acute
en lugar de
angle,
estar en
it's
un
an
ángulo agudo,
obtuse
está en un
angle.
ángulo obtuso.
See how you've
Vean
got that little
ustedes
bit of
cómo
an
se
angle that
tiene un
comes
ángulo
away
ahí
from the
que se
chest
aleja
wall.
de la pared
So number one, we
torácica.
have pleural
En primer
effusion.
lugar
Everybody
tenemos un derrame
recognizes
pleural,
that.
todo el mundo lo
But did
reconoce,
you
lo ve,
recognize
pero
that
vieron
pleural
ustedes que
effusion
este
here,
derrame pleural
what we thought
aquí,
was pleural
lo que
effusion,
pensamos que era un
has a
derrame
rounded
pleural,
margin?
tiene un margen
Can
redondo.
pleural effusion have a rounded margin? I guess if you had a big hematoma,
Podría ser un gran
it
hematoma,
could.
podría ser un
But
gran
in this
hematoma, pero en
case,
este caso,
because of the
debido
shoulder
a
sign
el
or
signo
the
del hombro
extrapleural
o el
sign
signo extrapleural
and the loss
y
of
debido a la
rib,
pérdida de esa costilla,
we have,
pues entonces tenemos
in this case, a
en este caso
chondrosarcoma
un
of that
condrosarcoma
seventh left rib
en la séptima
with
costilla
the
izquierda
hemorrhaging associated with
con
it.
una
What do we
hemorragia
look
asociada,
for?
que es lo que
Lost the
tenemos que
rib.
buscar,
I
esa
look
costilla
at
que ya no
every
está ahí.
rib.
Yo siempre veo
I
todas las
take my
costillas,
finger and go
tomo
up
el
and down
dedo
every
y voy
rib. I know
examinando
you think that's
cada
hard to
costilla.
believe,
Pensarán que es
but I
difícil de creer,
promise
pero
you.
les juro que,
Because here's a
porque
case.
miren, este es un caso
If you
en donde
recognize
si
the rib was
ustedes ven
partially gone,
que
and
desapareció
you
parcialmente esa
recognize
costilla
the
y
difference in
observan la
appearance
diferencia, la
here
apariencia aquí
and
y
here,
acá, hay una diferencia de
and the
apariencia
left side
y
here
el
compared to the
costado izquierdo en
right,
comparación
you
con
can
el derecho
find out
está
why.
diferente y entonces ahí
Now,
podrán averiguar por
if
qué.
you went
Ahora,
and
si
tapped the
ustedes fueran
effusion,
a puncionar
did a
ese derrame
thoracocentesis,
con una
and came back
toracocentesis
and
y
re-radiographed it,
fueran a volver
I
a
bet
tomar
you'd
una
see it
radiografía,
better.
lo verían mejor,
But this
se los
is
aseguro.
where
Pero es aquí
being
en donde
systematic
el ser
is
sistemático
so
es
important.
tan importante.
If you
Si
had, if you've been
ustedes han
systematic,
sido
you looked at the chest
sistemáticos y
wall,
vieron
you
la
looked
pared
at the ribs,
torácica y
you see
vieron las
the lesion.
costillas, pues entonces
So
habrán
the
visto la
goal
lesión.
here is
La
being
meta aquí es ser
systematic.
sistemáticos.
Look at the chest
Hay que
wall.
ver la pared
It's
torácica,
part of the
es
thorax.
parte del tórax.
Remember the dog that I
Acuérdense que
showed
el
you
perro que les
that had
enseñé, que
a mass
tenía
in the
una
ventral
masa en el
abdomen
abdomen
on the
ventral,
skin and the
en la
subcutaneous
piel,
tissue
en el tejido
was sent to us for a
subcutáneo, nos lo
pulmonary
mandaron
mass.
porque decían que tenía
It
una
wasn't
masa
a
pulmonar.
pulmonary
No era
mass,
una masa
it was a
pulmonar,
mass on
era
the
una masa en
skin
la
that
piel
gave the
que daba la
appearance
apariencia
of a pulmonary
de una
mass.
masa pulmonar.
There's a big difference.
Hay
So
una gran
take
diferencia,
the time to
entonces
look at
dense el
that.
tiempo para
Sometimes if I see a
observarlo.
little
Muchas
skin
veces,
tag
si
or
veo
nodule,
algún
I should
nódulo,
put a little
una verruguita,
barium
pues
on
le
the skin
coloco bario en la
and
piel y
re-radiograph
luego
the
vuelvo a tomar
patient
otra
to see
radiografía
if
del
the
paciente para ver
nodule
si ese
that I
nódulo que
see
yo vi
superimposed
está
over the lungs
sobreimpuesto sobre los
is the skin
pulmones y si
nodule
es un
or a
nódulo
true
cutáneo
pulmonary
o
nodule.
realmente si es un nódulo pulmonar. O sea, fijo
All
para
right,
ver esa
here we go.
diferencia.
1-year-old
Aquí
husky
tenemos un
vomiting.
husky de 1 año que está vomitando.
Radiographic
Hay
changes,
cambios radiográficos,
diagnosis,
el diagnóstico
recommendation.
y la
All
recomendación.
right? Normal
Eso es lo que
or
vamos a ver.
abnormal?
¿La imagen es normal o es anormal?
Normal. Some people say
Normal. Hay
normal.
quienes dicen que es
Who
normal.
said it was normal?
¿Quién dijo que era
I'm going to
normal?
ask.
Ahora voy a
And if you said it was
preguntar, si
normal, that's
dijeron que
not
está
a
normal,
problem.
qué bueno, no
Because
hay
we're going
ningún
to learn
problema,
from it.
porque vamos a aprender
All
de
right.
esto.
Let's say you thought it
Digamos
was
que
normal.
pensaron que era
You
normal
weren't
y
sure.
porque no estaban
What
seguros.
could you do next?
¿Y qué pueden
What
hacer
is
a
something I
continuación?
taught you the other
¿Qué
day
les enseñé el otro
in
día?
old radiographic techniques revisited?
En una
What
técnica
did I
vieja
tell you
radiográfica que volvemos a
yesterday with GI
retomar, que les
obstruction?
mostré ayer
What
con
is
las
a
obstrucciones
routine set
gastrointestinales.
of abdominal radiographs for
¿Cuáles son
me?
las radiografías de
3.
rutina
What are we missing?
gastrointestinales para mí?
We're
Primero,
missing the other one.
¿qué
Okay,
es
I'm
lo
going
que
to
no
put you on the
estamos
spot.
viendo? Bueno, ahora les voy a
Is this
seguir
right lateral
preguntando.
or left lateral?
¿Es lateral
Lateral.
izquierda o
Ah.
lateral derecha?
Izquierda.
¿Cuál es?
Right.
Es
It is
lateral
right.
derecha, sí es
Look at where
lateral
the
derecha.
gas is. The
Bien,
gas is
¿dónde
in
está
the
el gas? El
fundus.
gas está en el
Right
fondo
side
gástrico.
down, gas rises to the
El
fundus.
gas sube
If
hacia el
we're worried
fondo.
about an
Y si
obstruction
hubiera
at
una
the
obstrucción
outflow of the
en la
stomach,
salida del
we want
estómago,
left side down
el
so
izquierdo
the
estaría
gas
hacia
comes
abajo
to the
y
pylorus.
entonces el
So
gas
the
subiría
first
del
thing I would
píloro. Lo
recommend in a
primero que
dog
les
like
recomiendo en
this
un perro como
is
este
here's our right
es que
lateral we just
utilicen
looked
el
at.
derecho lateral, que
Here's
lo
our
vean desde
left
ahí, y aquí
lateral.
tenemos el izquierdo
Now,
lateral. Ahora bien,
if you looked at
si
this
ustedes
abdomen and said,
vieron el abdomen y
"No,
dijeron,
there's some loops of
bueno, es que
intestine
aquí hay
that are
algunas asas
abnormally
intestinales que
dilated,
están
but I'm
con una
not
dilatación
sure.
anormal, pero
I'm
no estoy
not
tan
sure he's
seguro, no estoy tan
obstructed."
seguro que sea una
By
obstrucción.
taking the left
Bueno, pues al tomar
lateral,
el
look at the
lateral
gas
izquierdo,
that
vean
was in the
ustedes el
stomach
gas que
that's
estaba
now
en
in
el
the small
estómago y que ahora se
intestine.
fue al
The
intestino
gas in the
delgado.
small
El gas del
intestine
intestino
has
delgado
shifted.
ya se movió,
It's changed
ahora ya
the place of
cambió
where it was.
el lugar
Now
donde
look at
estaba.
loops abound
Ahora vean
like
ustedes
this. Look at that
estas
loop
asas
abound. That loop
intestinales, vean
abound.
esta asa
Look at
intestinal,
that one
vean
and
esta de
that
acá
one.
y esta de otra de
Look
por
at the
acá.
normal
Vean
loop
ustedes
abound
aquí
here.
esta
So we
asa
have
intestinal normal.
multiple
Tenemos entonces
populations.
varias
One of
poblaciones
the
y una de
populations
las
is
poblaciones es
pathologic,
patológica.
right here.
Aquí.
So we have
Entonces,
an
pues tenemos
obstructive
aquí
pattern.
un patrón
We have
obstructivo.
a mechanical
Tenemos
ileus
aquí un
because
hilio
we've got
mecánico porque
segmental
tenemos aquí
dilation.
dilatación
We have
segmentaria,
non-uniform dilation.
tenemos dilatación uniforme no
Some of that
normal y
non-uniform
parte
is
de
pathologic.
esta no uniforme es
Greater than
patológica,
2 times
es 2 veces
L5.
mayor que L5.
Do I want to go to surgery with this patient?
Voy a
How
llevar
many
a
people
cirugía
want
al
to send this
paciente.
dog to
¿Quiénes de
surgery?
ustedes mandarían este perro a cirugía?
Okay,
Bueno,
so here's a
pues
question.
entonces esta es la pregunta.
Those of you who want to
Aquellos
see
de
go to
ustedes
surgery,
que lo mandarían a
you
cirugía,
see that he's
ven
obstructed.
ustedes que hay
Do
una
you know
obstrucción
why
y
he's
saben
obstructed
por qué
or
existe esa
what's
obstrucción,
causing
qué está
the
ocasionando
obstruction?
esa obstrucción. ¿Lo saben?
What's causing the
¿Qué está
obstruction?
ocasionando esa obstrucción?
Right here.
Aquí.
How do you know that's
¿Cómo
not the
saben
colon?
que ese no es el colon?
Because of its location?
Por su ubicación.
Because you think the colon
Porque
should be
piensan
more
que el
dorsal.
colon debería estar en dirección más
Interestingly
dorsal.
enough, the colon is
Interesante que
very,
el
very
colon
mobile.
es muy móvil.
Do you know, we
Déjenme
always think
decirles,
of the
siempre
colon,
pensamos en el colon
we always think of
y
the colon
pensamos
as
que
coming
el colon
down.
baja.
on the
baja
left side of
del
the
lado
abdomen,
izquierdo
you
del
know
abdomen.
that the
Saben
descending
que el
colon
colon
can actually
descendente,
come down
de hecho, puede
the right
bajar
side of the
por el lado
abdomen.
derecho
It
del
is very
abdomen
mobile.
porque se mueve
So
mucho.
I sent an animal to
Entonces,
surgery one
mandé
time
un animal a
because I
cirugía una
saw a
vez
loop of
porque vi
bowel
aquí esa
on
asa
the
intestinal
right
del lado
side,
derecho
and I thought it
y
was
pensé
obstructed.
que
It
había
turned
una
out to be the
obstrucción
colon
y
because the
resultó que era el colon,
colon
porque el
doesn't always
colon no
go
siempre
distally on the
va
left. It can be the
distal hacia la
right.
izquierda, se
So
puede ir a la
here's that
derecha.
area
Entonces miren, aquí está
here.
esta área
Here's
y
that
aquí
area
tenemos esta
right there.
otra área acá.
And remember, I
Y
also
acuérdense
told you the
que
other
siempre
day,
que les
look at
enseñé
the
el otro día que
pattern
tienen que
of
buscar el
material.
patrón
Look
del
at the
material, tienen
pattern.
que buscar
This
el
almost has a
patrón.
nice
Aquí
linear
vemos que
pattern.
tiene un
Let's
patrón lineal
magnify.
muy bueno. Vamos a
See how it
amplificarlo.
looks
Vean
like it's got
ustedes
a
cómo se
linear
ve, como que si tuviera
folded pattern
aquí un
to it?
patrón doblado,
But I'm
lineal,
guessing I'm
de
still
doblez
not
lineal,
sure.
pero aún así no estoy
What
tan
can I
seguro.
do
Entonces, ¿qué
to
puedo
make
hacer
sure that's
para
not colon?
asegurarme de que no sea el colon?
I'm going to do a pneumocolon.
Neumocolon,
Exactly.
hagamos un
So
neumocolon. Muy
here I
bien,
put a
entonces aquí
catheter
meto un
in the
catéter
colon.
en el
I
colon
filled
y
the
entonces
colon with
lleno el
gas,
colon con
and guess
gas
what?
y adivinen qué.
That loop of
Esa asa
intestine is
intestinal
still there
sigue ahí
with that really nice pattern.
con ese
See the pattern?
patrón tan
See
bonito. Vean
how
el patrón,
linear it
vean
is?
que ese patrón es muy
This should
lineal
be linear.
y no debe ser
So when I
lineal.
see linear,
Cuando veo un
what am
patrón
I thinking
lineal,
of?
¿en qué pienso?
Textiles,
Textiles,
socks, underwear,
calcetines,
towels,
toallas,
all
ropa
kinds of
interior,
things.
material textil.
And that's what this was.
Y esto es lo que
That's
eso era,
not the sock.
justamente.
I just
No
stole
es
the
un,
sock
no es
from
un
the
calcetín,
internet
me acabo de robar
because the
un
sock was much more yellow and
calcetín
green. But
del
a
internet
couple
por
of
los
great
colores, pero
important teachings from this
sí,
one.
lo que
Number
debemos
one,
aprender de este
obstructed
caso
pattern.
es que vemos un patrón
Number
obstructivo.
two,
Número
look at
dos,
the
tienen que
pattern
ver
of
ustedes
the
el patrón
material in the
del
small intestine
material
or stomach.
en el intestino delgado
Is
del
its
estómago.
pattern, does it have
El
a pattern
patrón
that's
tiene
linear
un
or
patrón
folded
lineal
linear,
o es
like
lineal doblado
textile?
como si fuera un
If it's a
textil.
mineralized
Si
foreign
es
body,
un
or
cuerpo
if it's a
extraño
metallic
mineralizado
foreign
o
body,
es un
that's easy.
cuerpo extraño metálico, pues ese sería más fácil.
And if
Pero
you're not
si no están
sure
seguros, si
whether
no
it's
están
colon
seguros
or
de si
small
es
intestine,
el
put
colon,
some
el
air in the
colon o el intestino
colon.
delgado,
That's
métanle aire al
all we
colon.
did here.
Es lo único
We
que
put a
hicimos aquí.
tube
Le
in,
metimos
we
una sonda,
introduced gas
le
into the
metimos
colon
gas
and
al
cecum.
colon y al
And
ciego
this
y
remains.
pues
This is
esto
jejunal.
se
If
mantuvo
you're
igual.
not
Ese es el
careful,
yeyuno. Si
many
no tienen
times
cuidado
in
muchas
my
veces
career,
en mi
I've
carrera,
watched foreign
pues veo
material
material
in the
extraño
jejunum go right
en el
towards the pelvic
yeyuno
canal.
y que
Look
se
where
ve
it ends.
directamente al canal pélvico.
So if you didn't have the
Entonces, si
colon filled with
ustedes no
gas,
hubieran llenado
you go,
con gas el
okay,
colon,
it's the
hubieran
colon.
dicho, es el
Because it's
colon,
going right towards the
porque
pelvic
va
canal.
hacia
The
la derecha del
colon
canal
is
pélvico, pero el colon
incredibly
se mueve
mobile.
muchísimo,
It
como
doesn't
les
always
decía,
have
no
to sit
siempre
here.
tiene que estar
Here it
aquí.
is. It can
Acá
go
está,
ventral,
pero puede
and
irse en
it can go
dirección
right
ventral
side.
o se puede ir al lado derecho.
I hear surgeons
He
sometimes
escuchado
say,
cirujanos que me han dicho,
I'm going to have some negative exploratories.
voy a
You know, I
obtener
think there's an
resultados
abnormality,
exploratorios
I'll
negativos.
explore
Hay
it.
una
And if it's negative,
anormalidad
it's
en la
negative.
exploración y si sale negativo, pues sale
First of all,
negativo.
no
Pero
surgeon's ever going to
ningún
put a knife
cirujano
to my
va a
abdomen
meter
for a
un
negative
bisturí
exploratory.
en un
You
abdomen cuando hay
better
un
know
resultado
for
exploratorio
sure
negativo.
what you're going
Deben de
after.
saber más bien qué
And
es lo
as
que
an
buscan.
imager,
Y
as a
como
radiologist,
imagenólogos, como
my
radiólogos,
job as a
mi trabajo
veterinarian,
también como
remember,
veterinario, porque
your
acuérdense,
job is
esa es la
far
labor
more
de
difficult than
ustedes
mine
y
is.
su labor es más difícil que
You
la
have to
mía.
be an
Ustedes
ophthalmologist
tienen que
and a
ser como
neurologist
oftalmólogos,
and a
como neurólogos, como
nephrologist
nefrólogos
and a
y como
gastroenterologist and a
gastroenterólogos,
surgeon
como cirujanos
and a
y como
psychologist for
psicólogos
behavioral
también
problems.
por problemas
All I
conductuales.
have to do is image.
Yo lo único que tengo que hacer
But
es ver las
if I
imágenes o
can
tomar
put a
las imágenes,
catheter
pero si
in the
puedo meter un
colon
catéter en
and
el
fill it
colon
up and know
y lo
that
puedo
small
llenar
bowel, then I'm comfortable.
y saber que no es el intestino delgado,
All
pues
right.
con eso me quedo
Another
satisfecho.
one.
Veamos
Here's
otro.
an animal
Aquí
presented
tenemos un
for
animal que llega
Annapolis, 3-year-old
porque no
labs.
come
There's a reason I
3
use
años, por eso
Labradors
utilizo
a lot
labradores. Este
because
es un
we
labrador de
see
3 años y
a
los
lot
uso
of
porque
them.
vemos
All
muchísimos
right.
labradores.
The
Entonces el
diagnosis,
diagnóstico,
if you can see
vean ustedes,
abnormalities,
¿ven alguna
remember,
abnormalidad?
somebody asked me
Alguien
yesterday,
me
how do you
preguntó
describe
cómo
them?
podemos describirlas.
LMNOSS. Those are ranking signs.
Esos son los
Location,
signos,
L,
ubicación
M,
L,
margination,
M,
N,
marginación M,
number,
N,
O,
número de
opacity,
opacidades,
SS,
SS,
size,
tamaño y forma
If
en
that's
inglés.
how we
Si es así
describe
como
things,
nosotros describimos las cosas,
couple things.
entonces
I want you to
aquí
give me a
veremos
hand.
un par
Look
de
at the
cosas. Les voy a dar
stomach
una
and
clave.
small
Vean el
intestine.
estómago y el intestino
Where's my
delgado,
stomach
en donde
expert?
está
Is the
el
stomach
experto
normal or not?
del estómago.
Remember, dogs
¿Es normal
do appetite.
el estómago?
So
No.
it supposedly hasn't had anything to drink
El
or anything to
perro
eat.
está
Normal
inapetente, no ha
stomach,
comido, no ha bebido
abnormal
nada.
stomach.
¿Tiene un estómago normal o no anormal?
Here's
Es
the
anormal.
stomach
Aquí
that's
tenemos un
moderately
estómago que
Lleno.
está
Now
moderadamente
look at the
distendido.
opacity.
Ahora ven
This
ustedes
is
la
gray.
opacidad. Esto está
This is
gris.
a gray
Este
stomach.
es un
Líquido.
estómago
There's
gris.
fluid
Ahí
and
hay
gas
fluidos
creating
y
that
gas
gray.
que
And
generan
in
ese
an
color
appetite
gris.
animal,
Y en un
and
animal
I'll bet it was
inapetente,
vomiting.
No debe de
aparte
haber.
estaba
I'm bothered.
vomitando
Now let's see
y
what
eso
you
me
remember.
molesta. A
I
ver
see
si
a
se
stomach
acuerdan.
that's moderately
Dije que el
distended with
estómago está
gas and
moderadamente
fluid.
distendido con
Two
gas y con
differentials.
fluido y hay dos diagnósticos diferenciales.
Meaning
Puede
it's a
ser
true
mecánico, puede
obstruction,
ser una obstrucción
either from a
verdadera,
foreign
ya sea por un
body
cuerpo
or
extraño
a material
o por un material
or the
extraño
wall of
o
the
por
stomach
la
is
pared
thickened,
estomacal que
not
se ha
allowing
engrosado
things to get
y que
out.
no permite que nada
Or
salga.
it's
O bien
functional,
puede ser un problema
gastritis,
funcional, puede ser
pancreatitis.
gastritis,
It's on a
pancreatitis,
drug that may have
puede ser un
affected
medicamento que haya
motility,
afectado la motilidad
dysautonomia,
intestinal,
where I come from.
disautonomía,
So
por
I'm
ejemplo.
bothered by
Entonces
that.
eso me
And then the
molesta.
other
Y
question
la otra
is how about the
pregunta
small
es,
intestine?
pues ver el intestino
So
delgado.
don't just
No
do the
nada más vean
stomach.
ustedes el
Look at the
estómago,
small
vean
intestine
ustedes el
too on this
intestino
patient.
delgado también de este
Normal,
paciente. ¿Es normal
abnormal.
o es anormal?
Abnormal.
Anormal.
Why?
¿Por qué?
Not so much that it's
No tanto porque esté
distended, but
distendido.
look at the
Observen
contents.
los
Now,
contenidos.
I want
Ahora,
to know, I don't know whether that's
no sé
colon or not,
si eso es
but
colon o no,
look at the
pero
contents, it's kind of
observen
linear. See
este
that kind
contorno
of
que es un
textile
tanto lineal. ¿Se
appearance?
acuerdan de esa apariencia
Now, shoot.
de textil?
What would you like to do
¿Qué les
next?
gustaría hacer a continuación?
Other lateral,
Otra
right?
vista
I'm
lateral.
not showing it to you, and
No se
I
las
probably am
estoy mostrando y
cheating because I'm
probablemente
not,
estoy haciendo
because I want
trampa
you
por
to
no
ask
hacerlo,
for it.
pero
I
quería
want
yo
you to
que ustedes
recognize how
reconocieran y
important
la
it is.
midieran por
So
su
now we go to the
importancia.
left lateral.
Entonces esta es
Does that
la
help
otra
you
vista lateral que
make
les
a
ayuda a
diagnosis
realizar
in this dog
un
that's
diagnóstico en este
inhabited
perro
and
que está
vomiting?
inapetente y que está vomitando?
Do you
Esta es la
see
izquierda
the
lateral.
cause of this
¿Encuentran la
dog's
causa
problem?
del problema que tiene este perro?
Twofold. Number one,
Bueno,
remember
número uno,
before
recuerden que antes
the gas was here in the
el
front,
gas
this
estaba
because it
aquí
was
en
the
el
right
fondo
lateral.
gástrico porque era la
When we
derecha
turn the
lateral.
animal over,
Al
now
voltear
the
al animal,
gas is
ahora el
in
gas
the
está en
pylorus
el píloro
and the duodenum.
y el duodeno.
And if you look
Y si
carefully,
ven
there's
cuidadosamente,
something abnormal
hay algo
in the
anormal
pylorus.
en el píloro.
And if we follow
Y
it,
si
here's the
le damos
duodenum,
seguimiento, aquí está el
look at
duodeno,
the duodenum
vean el
right
duodeno
here,
aquí
and look at that.
y observen esto.
And then look at the
Y luego
continuation.
vean la continuación.
This animal has a
Este
linear
animal
foreign body
Tiene un cuerpo extraño lineal,
that's anchored in the
anclado en el píloro.
pylorus. And here
Y
it's
acá
causing beautiful
Cuerpo
estamos
extraño
haciendo
lineal.
estas
Look at the
plicaturas.
margin of the
Vean
small
el
intestine.
margen de
See
este
how
intestino delgado.
plicated it
Ven cuán
is?
plegado
The
está
linear pattern. So
en este
number
patrón
one,
lineal.
it's anchored in the
Número uno, está
pylorus.
anclado en el
Number
píloro.
two,
Número
we
dos,
have plication.
tenemos estas
Beautiful
plicaturas.
plication.
Estas
And
plicaturas
you
muy
see the
hermosas.
textile appearance
Vean esta
to the
apariencia como
material.
textil de ese
Now,
material.
interesting fact,
Un hecho
dogs
interesante,
with linear
los
foreign
perros con
bodies
cuerpos
tend
extraños y
to
lineares
anchor in the
tienden a
pylorus.
anclarse esos cuerpos extraños
Cats
en el
with
píloro.
linear
En los
foreign bodies
gatos, cuando
tend
tienen
to
cuerpos extraños,
anchor
esos cuerpos extraños
under
se
the
anclan
tongue
generalmente bajo la lengua
or
o
in the
en el
pylorus.
píloro.
They don't have to, but the
No tienen
tendency
que, pero la
is in
tendencia
most
es que en
dogs
la mayoría de los
they tend
perros
to anchor here.
los cuerpos
And by
extraños se
doing
anclan
a
aquí
left lateral,
y haciendo
you've
esta
now
vista
used
izquierda
gas
lateral,
that was already
ese
there
gas que ya estaba ahí lo
as a
podemos
contrast
utilizar
material.
como un medio de
Remember,
contraste.
barium is a
Recuerden,
positive
el bario
contrast,
es un
gas
contraste
is a
positivo, el
negative
gas es un
contrast.
contraste
And
negativo.
when we take
Y
it to the
cuando
left lateral, we use
hacemos
the
la
gas to show
lateral,
this.
el gas nos
We've
ayuda
also
a
used
percibir
it to help
mejor, a
us
ver
see.
mejor.
Does
También nos
everybody
ayuda
see
a
the
ver, ¿todos pueden
plication?
ver las plicaturas? Esos pliegues que hay ahí, ¿todos los pueden ver?
Here it is.
Aquí están.
I magnified
La
it.
amplié, la
There's that
amplifiqué.
plication.
Aquí se ven claramente
Look
las
at the
plicaturas,
linear
los pliegues, vean
pattern.
el
Look at the
patrón
linear
lineal.
pattern.
Vean aquí
This
el
involved
patrón lineal.
almost the
Esto
entire
involucra
jejunum of
prácticamente
this
todo
dog.
el
I think
yeyuno
they
del
had to do
perro.
5
Creo que tuvieron que hacer
enterotomies
6
and a
enterotomías y
gastrotomy
una
to
gastrotomía
get
para poder
all of
extraer
Boxer.
this out of there.
todo esto de ahí.
So the fact is,
El hecho es
I'm very lucky. I
que
own a
tengo mucha
Labrador.
suerte.
She
Yo tengo
carries
una
3, 4
labrador
socks in her mouth all the
todo el
time.
tiempo lleva
Knock
1,
on
2 o
wood,
3
she's
calcetines
never
en la boca y
swallowed
jamás
it.
se ha
Our
comido
standard
ninguno.
poodle has,
Nuestro
but not hers.
poodle standard sí,
Great
pero no el
example. So
labrador.
teaching,
Es un buen
left
ejemplo.
lateral,
Izquierda lateral,
teaching,
es muy importante esa
use
vista.
the gas, the
Utilicen
pylorus
el
as
gas
contrast,
y
look at
el
the
pil
pattern of
del pelo
material,
como contraste. Vean
and
el
in this
patrón
case,
material y en
look
este
at the
caso
margin of the small
observen el margen
intestine.
del
Is it
intestino delgado.
smooth,
¿Está liso
or in this case,
o
is
en
it
este caso
plicated? All
con
right,
pliegues,
here's another good one.
plicaturas? Aquí tenemos otro caso.
4-year-old male setter vomiting
Setters de
7
4 años
weeks. This
tiene
thing's
7
been
semanas
vomiting for
vomitando. Ha estado
7
vomitando
weeks.
durante 7 semanas este perro.
It's presented to us because they refer
Vino
to
con
it for a
nosotros
testicular tumor.
Por,
It's got a
fue
swelling,
referido
its
por
scrotum
un
is
tumor
very,
testicular que
very
está
large.
muy
So it's
agrandado.
been sent to me
Fue referido
to image the animal
para
looking for
tomar las
metastatic
imágenes
disease.
para
So
buscar
here's
enfermedad
vomiting.
metastástica. Y
And I
está
looked at the
vomitando.
abdomen. We took great
Analicé
investigation.
el abdomen.
Normal, abnormal.
¿Es normal o anormal la imagen?
Abnormal.
Anormal.
Okay, be careful on this one.
Cuidados aquí.
Abnormal.
Anormal.
So you're saying it's
Entonces
abnormal
estás
because
diciendo
this
que es
loop of
anormal
bowel?
por esta asa
Why are you saying, who said it's
intestinal.
abnormal? Give me,
¿Quién dice
somebody,
que es anormal? Levanten
why
la
did
mano.
you say it's
¿Por qué
abnormal?
dicen que es anormal?
Oh, you think the prostate is big?
Ah, ¿tú crees que la
Okay.
próstata está agrandada?
Okay.
Ok, muy bien.
It's hard because
Es difícil.
I don't have a lot of the
Porque no
caudal abdomen on there,
Tengo mucho
so
del
the
abdomen
prostate
caudal,
may
así
be
es que la
big.
próstata
But
puede estar
remember,
agrandada, pero recuerden
prostatomegaly
que
can be
la
just
próstata
a 4-year-old dog that's
en
intact,
un perro de
right?
4
Doesn't-
años,
so
ahí la próstata realmente
BPH,
está
benign
intacta.
prostatic
BPH
hyperplasia,
o la hiperplasia
can be,
prostática benigna
some people think it's almost a normal finding.
casi podría ser un hallazgo normal para algunas personas.
Yes, it can. Great question.
Muy buena pregunta,
But
no se escuchó,
this
disculpen.
is a male.
Este es un macho.
If he were a male castrated,
Si fuera un macho castrado,
he's a male. He's intact.
pero él es intacto, está intacto.
Most of our
La mayoría
prostatic
de
tumors
nuestros
are
tumores
in
prostáticos
male
es en
castrated dogs.
machos
We see
castrados.
tumors in the
Vemos
prostate
tumores en la
far
próstata
greater in
mucho
castrated
más
male dogs,
en machos
and they're
castrados
usually
que
not
los
massively
enteros y
enlarged.
generalmente no
The
son
classic appearance
masas muy
is
grandes. La apariencia clásica es una
mineralization in the
mineralización
prostate that's
en la próstata
enlarged in a
que lleva su
castrated male. So good question.
agrandamiento, y esto pasa en los machos castrados. Buena pregunta.
I'm sorry.
Perdón.
No. If you've got a
Si
question,
tienen una pregunta,
I'm here for you. You guys, I'm not here for you.
yo estoy aquí para ustedes, ya lo saben.
No, I said that castrated males
Que
have
los
a
machos
greater
castrados tienen una
chance for
mayor probabilidad
prostatic
de desarrollar
tumor.
tumores prostáticos.
Okay, prostatic disease is more common in intact males. Abscessation, prostatitis,
Rottweiler.
BPH.
BPH,
Okay. And I'm sure it's my fault.
y seguramente es
My fault. In colpalme,
yo soy
which is in Italian means my fault, right? Blame me.
Cúlpenme
I
a
don't
mí.
know what it would be in
No sé
Spanish.
cómo se dice en español.
You're saying that it is more common to have prostatic problems with castrated.
No.
No se escucha en cabina.
Okay, we're talking about something. Okay, I'm going to say this once and then we're going to go on with this case. Prostatic disease in intact males are prostatitis,
Prostatitis,
benign prostatic hyperplasia, abscessation. Prostatic tumors are more common in castrated male
en los machos
dogs.
castrados.
That's what I meant to
Eso es lo que
say.
quise decir.
Okay?
Sí.
What?
The age where you perform the castration has something to do with the tumor?
The question is, does the age of castration have something to do with the tumor? No, we see tumors in animals that are castrated early and some that are castrated late. So we see them in both. I'm sure there's somewhere in the literature that it says that you see it more commonly, maybe in the later castration. But let's move on. Let's move on. Back to this case. So how many people think it's abnormal? Forget the prostate. Forget that. Okay. I'm sorry. I have let it get out of control. It's my fault. So how many people think the abdomen is abnormal? Okay. Now, do you think he's abnormal because of this loop of valve that's quite distended? Okay, but how do we know that's not the colon? Look at what it's doing. It's heading towards the pelvic canal. So that may be colon. Now, if it's not colon, it's a major problem. What can I do? What can I do to know whether that's colon or not? I can put air. I can do a pneumocolon. But in this case, I didn't do a pneumocolon. I actually used a little barium. And the reason I used a little barium is because with this, I wanted to make sure that I either filled this with barium or I didn't fill it with barium, because it was already filled with so much gas. So I put a little barium, and in fact, there's the colon. That loop of bowel is still distended. And by the way, now there's some other loops of bowel that are abnormally distended. So we call this a partial barium enema. Same principle. It says this is colon right here, this is not. This is not the colon. And in fact, what happened is this animal didn't have a damn testicular tumor at all. The jejunum had gotten through the inguinal ring and down into the scrotum. So it actually had incarcerated small intestine into the scrotum, and that's why that loop of bowel is heading towards the pelvic canal, because it was going in down through the inguinal ring into the scrotum. So we diagnosed it. I used ultrasound. I looked at the scrotum, and it was small intestine in there. We went to do surgery. This dog did great. We had to do a resection and anastomosis. But the whole reason I showed you this case is because if you weren't thinking about, you would automatically assume that was colon. And by something as simple as putting barium in there, we diagnosed it as not colon. All right. Presented for geriatric exam. This is an old dog, and we provide a geriatric exam for animals over 7 years of age. Thoracic radiographs are included. This is what we saw. This animal is clinically normal. So what I'm trying to do is remind you, I'm not even going to ask you if it's abnormal or normal, because everybody knows it's abnormal, right? The question is, I taught you the other day, when you lose the ability to define the diaphragm, border effacement. You lose the border of the diaphragm, you think of three things: fluid, diaphragmatic hernia or rupture, and disease in the caudal lung lobes that are adjacent. So the question is, and you can have combinations, what do you think is going on in this dog? Do you see pleural effusion? No. Do you see a diaphragmatic hernia? Do you see a lung lobe mass? How many people are willing to bet me that you believe it's a lung lobe mass easily, and I'll bet you it's not? How many people are confident? I'll bet you 20 pesos. What's that? $1? No, I'm not betting you. I don't want to take your hard-earned money. Diaphragmatic hernia. Somebody says diaphragmatic hernia. Okay, So what did we do on this? There's a couple things that help us. Number one is border effacement. Could be a pulmonary mass. But we did a left lateral. Here's the left lateral. I'm sorry. Yeah. Right here. Okay. Remember what we look for extrapleural disease? Remember our rib lesion? Look at this right here.
La carina.
Look at the diaphragm and look at what happens here. That's that extrapleural sign. Remember, if it's a lung mass, the mass should probably come around this way, and we get an acute angle, but this is an obtuse angle. All right? See the obtuse angle right here? That tells me it's extrapleural. We went to CT, that was liver. That was liver extending into the chest. The dog had probably had that for years. It was of no consequence. But the important thing that I wanted you to learn, what's the take home? Number one, 3 different things that cause border effacement of the diaphragm. Number 2, the fact that we see, once again, see how we see that obtuse angle? The angle is, that tells me it's extrapleural, whether it's from the chest wall or the diaphragm. So I just thought that was an interesting case. All right, here's another one. Here's a 10-year-old doodle with 6-day history of vomiting and decreased appetite. Normal, abnormal. And wait a minute now, be careful. If you see something you're convinced it's abnormal, say it's abnormal. If you're not convinced, you always have the ability to ask for more. Okay, but wait a minute. How many people think it's normal? How many people think it's abnormal? This is a great case. What's your recommendation? Left lateral. Here's your left lateral. Now, you thought it was normal. Do you still think it's normal with a left lateral? I don't think it's normal either. You know why? What have we done? We've taken the gas that was in the in the fundus, and we moved it to the pylorus. Look at the pylorus. That's the pylorus. That's what we saw at endoscopy. There is a mass in the pylorus. Now, here's an interesting thing. Some of you who thought that was abnormal were looking at the colon and cecum. That's the cecum. That's colon and cecum. Remember, one of the first things you need to learn to do is identify colon and cecum. Because colon and cecum can lead people to colon obstruction. If you're not sure, change the position of the animal. The gas in the colon and cecum, like the gas in the stomach, and like the gas in the small intestine, will change its location. So the fact is, a left lateral. If nothing else, from having to hear me go on and on for the last 3 days, add that left lateral. Add it in the thorax, add it in the abdomen. Do as many views as you need. You need to put gas in the stomach, put gas in the stomach. It wasn't necessary here. We had enough. Be aware, of where the cecum is and where the colon are. All right? Now, we're going to end with this case. This is the last case we're going to do. This is a 9-year-old border collie, vomited twice overnight, lethargic this morning, anorectic for 4 days. This dog hasn't eaten in 4 days. One of the first things I taught you was look at the context. If this dog hasn't eaten in 4 days, what the heck is going
Tiene que
on
tener
here?
comida.
There's something in the stomach. That bothers me. Now, at the same time, beware. What's this? It's the cecum. What's this? Cecum. What's this? Don't think that small intestine is obstructed. All right? Now, I'm just magnifying it. This is my last case. Last case, okay? Look at the material in the stomach. It hasn't eaten for 4 days. Look at the pattern of material. What do you think might be a nice, easy thing to do regarding this case? It's a technique we discussed the other day, we haven't discussed today. We've done a right lateral, we've done a left lateral. I'm bothered by the stomach, the pattern of material, and the fact that the dog hasn't eaten for 4 days. Gas in the stomach, a pneumogastogram. And that's exactly what we did. Now, what happened was we put the gas in the stomach, much of it came up, and much of it went into the small intestine. If you look here, there's not much gas in the small intestine. But if you look here, after the pneumogastogram, look at all the gas. That tells you it's not a complete obstruction. But look at the material here, look at the linear pattern of the material here, and look at the material. See it right here? See how linear it is? Look at the duodenum. That's the duodenum. Here's duodenum, overlapping small bowel. So we used the pneumogastogram, and they went to surgery, and this was the material in the stomach and duodenum. All we did was do an orogastric tube, put in about 12 mils of room air per kilogram of weight, and because we didn't have enough air in the stomach. When we have enough air, we'd have seen the problem. So now we've put air in to better define what the stomach wall looks like and the contents. All right. Any questions? Any questions? And if there, while we're walking back there, I want to thank you once again. All of you that came, all of you that participated, I really appreciate that. Don't worry about being wrong. Especially with me. I'm wrong more than all of you will ever be in your entire lifetime. But if you're wrong, learn from it. Okay? Questions?